All right, ladies and gentlemen, welcome to the Pandemic News Report. And we are live. We're going to take a live look, real time global health threats watch. Welcome. And now, here is your Pandemic News Report. Yes, indeed, ladies and gentlemen, you are looking at the live health map. And we're going to take a look here in the United States, as well as a few global locations as well. All right. So let's take a look at this health map, real time health map. And you guys see on the screen right now is the activity index and the different colors that represent from low to high. All right. And that's we're gonna look at a few of the high ones, and then we're gonna kind of go in the middle, which is that you guys can see on the screen is the red dots. And we're just gonna find out and see what's going on, okay? And yeah, give me a sec and let's move. We're gonna take a little zoom in real quick. All right. Let's zoom that in. All right. Let's move this out to the side real quick. Here's your activity index so you guys can see what that actually looks like in real time. All right. And yeah, let's zoom in a little bit into the United States and see what's going on right now. Okay. Let's take a look here. All right, let's take a look. We got a few red dots, it looks like. Some orange, which represents the low, like the light orange, and then the darker orange starts to get to the medium, and then we have some red dots, and then you have like a plum, like a light plum or light plum, and you have like a darker plum, which is the higher on the higher of the scale. So let's take a look at Florida and see what's going on. Looks like they have a dengue case right now. And then let's just click it in and see what's going on here. It says Florida reports 2 additional local dengue cases in Miami-Dade. All right. And then it looks like some COVID, might be a COVID-19 and dengue case in like middle Florida. All right. Let's take a look here. Florida reports 2 additional local dengue cases in Miami-Dade. COVID-19 deaths in Florida topped 100,000, but it's no longer among. And then you have Jesus Maria confronts dengue with management and territorial work. That was on November the 11th. So let's take a look and see what's going on for the November 17th really fast. COVID-19 deaths in Florida topped 100,000, but it's no longer among the top 15 causes of death. All right. And let's look at the article real fast here and see what they're talking about really fast. Let's see something real quick here. You guys stand by just a second. All right. And we're going to see if we can bring some audio in the mix here real quick. Okay. And you guys be able to hear this really fast here. Okay, we got the audio. And there we go. Let's see if we can pick up on what's going on here. All right. Okay. So again, COVID-19 deaths in Florida topped the 100,000, but it's no longer among the top 15 causes of death. All right. Let me just pull up one more thing here as well. You guys bear with us for a second or two. Just get some things loaded up here. Looks like we got that loaded up. All righty. So let's pull up this article really fast here. All right. See if we can locate that. There we go. And all right. Let's see what we got here. All right, let's listen in real quick.
COVID-19 may not be in too many people's thoughts anymore, but Florida recorded its 100,000th death related to the disease earlier this year. That comes more than 5.5 years after the first case was reported here. However, data from the Centers for Disease Control and Prevention says it's gone from the third leading cause of death in the state to falling out of the top 15. WUSF's Gabriel Velasquez Neira spoke with Dr. Mobeen Rathor. He's the chief of pediatric infectious diseases and immunology at the University of Florida's Jacksonville campus.
When we were in the middle of the pandemic, really, people were saying that once herd immunity happened, it was not going to be any more dangerous than the flu and other respiratory diseases that we have. How true has that been thus far?
Herd immunity is sometimes misunderstood. Herd immunity works in those conditions where the virus does not change. So, measles, if you get more than 95% of the people immunized against measles, then you can have herd immunity. Herd immunity does not work as well for diseases like influenza and COVID, where the virus is constantly changing. So, you have to immunize every season or every time there's a new virus variant that is circulating in the communities.
Right. And that's why we have to have our flu shots every year.
That's correct. And we have to get them every year, and we have to hopefully get them before the flu starts circulating in the community. So we are protecting ourselves and the community.
Doctor, one of the most important things that you mentioned there was the variations that come up, right? With influenza, you have two strains, type A, type B, one's more serious than the other. Learning from a similar respiratory disease like influenza to COVID, can we see almost a sharp resurgence like we did that in the 2020 pandemic?
Well, I think what we have learned from influenza, if you want to extrapolate that to COVID, is that influenza virus changes every season a little bit. We do get the vaccine, and sometimes there's a vaccine mismatch, meaning that what we predicted would be the circulating virus is not exactly what we predicted. We also know from influenza that the virus every 10 years will change significantly. Every year it's what we call a drift, and every 10 years or so we call a shift. We don't have that sort of information yet in terms of time wise. Is COVID going to have a drift every year, every 2 years, every 5 years? We don't know those things. So I think that's why surveillance is so important, so we can learn more about this virus, and we can plan better, better prevention and better response. So we are still learning about this virus.
Part of the data that I was looking at from the CDC shows that COVID went from being the most deadly respiratory disease to falling out of the top 15 leading causes of death in Florida.
Mhm.
Do you find any significance in that?
Only that we are learning about it. And again, this virus is very young, and we are still learning about it. So yeah, I mean, that's helpful. There's hope in that it will continue to decrease and hopefully will go away, and would just be a blip here or a blip there.
That was Dr. Mobeen Rathor speaking with WUSF's Gabriel Velasquez Neira.
All right, let's go back to the map and see what else is going on. Let's go back to the health map. All right, there we go. And let's take a look at so we did Florida. Let's look at Texas. They got something going on in Texas. Looks like bacterial meningitis, botulism, measles, meningitis, tetanus, and whooping cough. Let's take a look and see what's going on here. We're going to try to, oh, they kind of got it mixed up here. So we have a number of confirmed measles cases in Texas has risen to 58. That's the most recent for today. November the 12th, they had the number of whooping cough cases in Texas is the highest it's been. November 14th, cases jumped to 23 in the botulism outbreak tied to baby formula. Okay. Keep that in mind. November 13th, whooping cough cases in Texas quadrupled in number since last year. Got quite a bit of whooping cough cases in Texas. Inmate dies in Harris County Jail after contracting bacterial. Let's take a look at that real quick and find out what's going on there. After contracting bacterial meningitis, sheriff's office say. Okay. That's going to happen in Harris County. Health district in Central Texas reports 5 times more whooping cough cases. Okay. So we're going to go to the 18th. It looks like that's the most recent of situations that's been going on. So let's take a look at that. And that looks like it's showing an Asian lettering, but you got United States measles. So let's see what's going on here and see if it even has to deal with that. Yeah, looks like that's out of date. So that's several months ago. Okay. So now, guys, stand by a second, man, to pull that up. There you go. So it looks like a lot of whooping cough cases, botulism outbreak, it looks like. So you got quite a bit of going on in Texas. All right. Let's go over here to, let's see. Let's go to South Carolina and see what's going on there. Fever and measles. Let's go to today's date. Looks like 5 new South Carolina measles cases continues to fuel upstate outbreak, possible public transmission, Post and Courier. Let's take a look. Let's see what they're talking about here. 5 additional people have become infected with measles as part of ongoing outbreak in the upstate, and the source was unknown for 3 of them who may have been exposed while out in the public. The South Carolina Department of Public Health announced on November 18th. That's today. The new cases raised the outbreak total to 49, with 52 total people infected in the Palmetto State since July. 2 of the new infections were people who were in quarantine after being closely exposed to a known case. It is part of public health strategy to limit the spread by quickly identifying people with significant contact and isolating them, the state noted. Those cases are expected, so they say. Okay. So that's South Carolina. So you have any relatives, friends, family in South Carolina, tell them to be aware of that. Okay. All right, let's go over to the West Coast in California, further south, measles and West Nile virus. Let's see what's going on there. Their latest is on the 15th. West Nile virus positive mosquito sample found in Burbank. Let's take a look, find out what's going on there. All right. Let's see. Stand by a second. Let's see what's going on. West Nile virus positive mosquito sample found in Burbank. The Greater Los Angeles County Vector Control District has confirmed the positive West Nile virus mosquito sample in Burbank. So what does that mean? It simply means that mosquitoes carrying the virus have been identified in the area. And it's a good reminder to take simple steps that help reduce mosquito bites and keep our neighborhoods safe. So eliminate standing water around your home, maintain pools, spas, and ponds, change water in pet dishes and bird baths weekly, use insect repellent when outdoors, report neglected swimming pools to GLACVCD. I don't know if that's GLACFID or GLACFIDs. Let me see more details on the West Nile virus prevention and current activity in California. Visit glomosquito.org. All right. Let's put that on the screen real quick for you people who have some family in Burbank. Let's just put that on the screen real fast here. Get the website out real quick. I think that's .org, if I'm not mistaken. Make sure we get this correct. All right. Okay. So there's the website. Let's correct that a little bit. So those who have family in Burbank, they might want to check out that website. And in regards to the West Nile virus mosquito sample found in Burbank. Okay. So let's move on and let's see what's going on in Nevada. That's got a high level. It's on the higher side. And remember, here's the activity index so you guys can see. We're trying to look at the most higher levels instead of the low. We'll look at a few low ones, but we're trying to look at the higher ones and maybe mid-level from state to state. Okay, so we have Nevada, conflict and Marburg fever. Marburg virus in Ethiopia. So that might not have anything to do with Nevada. But it says global spread. So let's see what they're talking about here. Marburg virus in Ethiopia is dangerous, but broad global spread, they say, is unlikely. That's according to the Las Vegas Sun. Okay. Let's see what they're talking about here. So in Ethiopia, there's a confirmed 3 deaths from Marburg virus. So what they're trying to say is maybe someone tried to report that there were some Marburg cases in Nevada, but the Las Vegas Sun is saying otherwise, that the spread is not really likely. But nonetheless, keep an eye on that. Things could change. All right. But global spread, as they're saying, is unlikely. But we'll still keep our eyes on that. We got a few red dots, so let's check it out and see what's going on there. Okay. Stand by for a sec. We're going to go to Utah, and looks like Utah, Colorado, and then New Mexico. Let's see what's going on there. All right. Utah, new measles case reported in central Utah. It looks like a lot of measles cases are popping up in different states, in different cities, in different states. I'm noticing that off the top. So let's see what they're talking about here. Okay. Roughly 6 hours ago, central Utah has reported 2 measles cases. The first, if this is for you guys who are actually, if y'all might be in Utah or visiting, or you might have family or friends in Utah, or maybe coworkers. Central Utah has reported 2 measles cases, the first in the region, bringing the total number of cases in that state to 84. According to news release from Central Utah Health Department, both cases were in unvaccinated individuals who had recent contact with someone they believe had measles. Health officials say they have identified a small number of individuals who may be exposed to the 2 cases, but there are no further exposures or risks to the public at this time. Executive Director Nate Sellin stated that the recent rise in measles cases has led to the disease spreading quickly and potentially posing a serious threat. Like I said, just by doing these live watches, I've been noticing, just doing it now in real time, a lot of cities are having these measles outbreaks, or at least they're being reported to have measles outbreaks. So let your families know if they're in Utah. Let's go to Colorado. Let me get this out the way here. Stand by. Let's get that out the way. Let's go over to Colorado. Then we'll do New Mexico. And let's find out what's going on here. Latest looks like to be the 15th of November. That's a few days ago. Let's move this activity index over a little bit. And Colorado health officials. Nope, that's not the one we want. Let's go to the 15th. There we go. 2 dengue cases. Is that right? Let's take a look real quick. The mosquito can breed. It looks like 2 cases of dengue in Colorado there. The mosquito can breed in any damp space, such as abandoned containers, tires, accumulated garbage, or waterlogging. All right. Although an arid climate predominates on this border, the presence of the mosquito that transmits dengue is not ruled out during the season. For this reason, the Municipal Public Health Directorate urges the population to intensify preventive actions within homes to avoid breeding sites of the insect. The director of the agency, Dr. Claudia Morga, reported that according to the official report of the state, in San Luis Rio, Colorado, there are 2 positive cases of dengue, which makes it necessary to reinforce the measures of cleaning and elimination of objects that accumulate water. He recalled that the mosquito can reproduce in any space with humidity, such as abandoned containers, tires, accumulated garbage, or water logging. All right. That's Colorado. Dengue case, a couple of dengue cases. I don't recall when was the last time there were any dengue cases in the U.S. at all? Right? Let's see what's going on in New Mexico. It says no cases of infant botulism in New Mexico amid outbreak. Let's take a look at that. That was on the 13th of this month. Let's see what they're talking about here. All right. The New Mexico Department of Health says if you have by heart whole nutrition infant formula in your pantry, you should get rid of it immediately. And I'm going to repeat that. By heart whole nutrition infant formula. All right. They're saying to get rid of it immediately as of the 13th of this month. According to the New Mexico Department of Health, this brand of infant formula has been linked to 15 cases of botulism across 12 states. Okay. According to KRQE News, botulism is a disease that causes difficulty breathing, muscle paralysis, or even death. Health officials say New Mexico does not currently have any confirmed cases of infant botulism. All right. So again, that is the by heart whole nutrition infant formula. All right. So if you have any family or friends who has that type of formula for their children, you might want to let them know they might need to get rid of that so their children doesn't catch that botulism. If I'm not mistaken, was that botulism? Hold on. Yeah. All right. So let's see what we're going to do next here. We're going to go back to the East Coast and see what's going on the East Coast real quick. Okay. Looks like New Jersey. Let's go up to Jersey and then upstate New York. And then Connecticut. Okay. New Jersey. Looks like they got a couple of cases of something going on. Botulism, COVID-19, malaria, and then some pests, and then some botulism. Okay. Looks like a couple of botulism situations going on there. Let's move that out the way real quick. First death reported from tick-borne allergy. That's the 17th. Let me see. Skunk and Galloway Township confirmed by Atlantic cities, counties. We got several November 17th. New Jersey sees first malaria case in more than 3 decades. Let me see what else is going on. Okay. Let's take a look at that real quick about the malaria situation going on in New Jersey. Okay. New Jersey sees first malaria case in more than 3 decades, and it came from a local mosquito. Let me see here. This is probably, that's been a report in August. So they're real slow on getting this data information in. Okay, well, let's take a look at that. New Jersey may be dealing with its first case of malaria in more than 3 decades, and it came from local mosquito. I wonder why they taking their time to report that, though, or to make it kind of public. That's crazy. That happened in August, but they're reporting it now. I don't know. Maybe they had to verify it. I don't know. I'm not going to make any excuses for why it's now being mentioned. Maybe they had to verify it. I don't know. But we're going to keep you up on what's going on. So any families in New Jersey, keep them aware of that. The malaria-stricken patient lives in Morris County, according to the New Jersey Department of Health. The patient has not traveled outside of the U.S., so officials are looking into how he could have acquired the mosquito-borne disease stateside. Okay. Let me see what else we got here. To kind of leave that at that. Let's see what else is going on in Jersey real quick. Let's see what this is about. Okay, that's been covered up. They don't want anybody to know about that. Let me see what's going on here. Ladies and gentlemen, we are live. This is the Pandemic News Report. And let's see what's going on here. What's the date on this? Okay. Yesterday, first death reported from tick-borne allergy. Okay. The first death related to a tick-borne allergy has been reported. A New Jersey airline pilot died after developing alpha-gal syndrome. I think that's how you pronounce it. Alpha-gal or alpha-gal syndrome. The tick bite creates an allergy to red meat. Okay. According to a news source, researchers at the University of Virginia School of Medicine confirmed the death. The man died after eating a hamburger at a cookout. Okay. They got the years like really off on this one. That's crazy. Further testing revealed he suffered from a red meat allergy transmitted by a tick bite. Okay. Some of these reports are really slow to come in. Again, they're just now coming out, and I don't know if they had to confirm this, and they took a long time to confirm these incidents, but some of these incidents has happened months ago. And in some cases, they even happened a year ago. So just keep that in mind. There's incidents going on, and they're not reporting it in a timely manner. So that's why it's important to be aware of these incidents. And this is why we are going to be doing this on a regular basis to keep y'all posted on what's been going on here. What's this one right quick? Is this the same thing? I think they're reporting the same thing. Yeah. A 47-year-old airline pilot. Okay. Yeah, they're real slow on reporting these incidents. And that is not good. That they're slow on these reports and not telling the public what's going on. They're being real slow with this stuff. Let's go to Connecticut real quick. See what they got going. It kind of borders, kind of on the border of Connecticut and Massachusetts. Let me see. Massachusetts and Rhode Island. They kind of border with each other. So let's see what's going on there. All right. Let's take a look and see what's going on there. Okay. On the 14th preliminary case of bird flu, and let's say in Washington. Wow, why are they going to Washington State? And then let's see what's going on here. And make sure, let me see. That's interesting. Very interesting. Let's see, what's the date on this? November 17th, published 2025. Okay, let's get this out the way. Syphilis complicated with pericardial effusion, a case report. Let me see. Pericardial effusion is a relatively common clinical condition that can be classified into inflammatory and non-inflammatory types, with infection being the most frequent cause. However, syphilis as a etiological factor remains extremely rare. Case presentation: a 76-year-old male was admitted to the hospital due to progressive dizziness and exertional, I think that's how you pronounce it, dyspnea. I think that's how you pronounce that. Initial evaluation revealed moderate anemia, elevated inflammatory markers, and imaging confirmed moderate to large pericardial effusion. Despite blood transfusions and empirical therapies, nerve nutrition, diuretics, antibiotics, persistent low-grade fever, and worsening effusion necessitated pericardiocentesis. They're getting real deep with this, draining 220 milliliters of light red hemorrhagic exudate. So the conclusion is the presentation recommends syphilis testing in patients with unexplained or recurrent pericardial effusions going on. So let me see. Let me make sure I get that right. Pericardial effusion apparently reported in Connecticut. A complication, syphilis complicated. That's interesting. Okay, let's go to upstate New York and see what's been going on there. They have several dates. Let's go to the latest one, which is the 18th. CDC links measles outbreak in multiple states for the first time. The New York Times. Let's see. Like I said, there's been a lot of reported measles cases. All right. We can't get that pulled up for the New York Times. Let's see what's going on here. India and the United States. That's crazy. Yeah, they're taking their time to report a lot of this stuff. Like I said, some of this has happened months ago. And why I don't know. I'm not going to say they're doing this on purpose. And maybe they're trying to take their time to verify these confirmations of bird flu and other incidents, but they're taking their time and they're definitely not reporting this publicly. At least 3 ducks and 15 more birds have died due to avian flu in New York City zoos after possible exposure to the life-threatening virus, according to the Wildlife Conservation Society. The deaths, at Queens and Bronx zoos, one of the largest and most well-known facilities in the United States, come as an outbreak of H5N1 bird flu has spread across the country, sickening chickens and dairy cattle and driving up the price of eggs. Now, like I said, this one was 9 months ago, and I don't know why it's being reported on the 16th, a couple of days ago. They're real slow on informing the public. So I'm glad we actually doing this today, because none of y'all would have never known about this. They're being real slow about reports. And that's not going to work, because we had some issues during the pandemic for sure. So let's look at, I think, New Hampshire and Vermont. Let's see what's going on there. Nothing. They actually have nothing going on there. You guys are traveling out the country. Let's see what's going on in some other countries real quick. Let's move on over. That's a little bit too wide there. All right. A lot going on in Africa, Europe. Let's see what's going on here. Measles cases. Just gonna kind of read some of the stuff off. If you have family and friends traveling to, there's another Marburg fever case again. Let's see. Portugal might have some Marburg fever going on. Gibraltar, what they have here? West Nile virus infected eagles dies. That was several days ago. This is for you guys who have family traveling in other countries. Let's go to South America real quick and see what's going on there. In case you have family or friends traveling there, a lot of red dots. Dengue and encephalitis in Venezuela. That's Colombia. What we have in Colombia there? Another COVID-19, dengue, encephalitis, fever, influenza. And like I said, when it comes to these, whether it's the US or these other countries, some of them are reporting this really slow. So for those that I read off, and I let you know that they were several months behind in reporting this stuff. If you have family or friends that have been in those actual countries or cities and states, you might want to let them know they might want to get checked out. They could be infected with whatever diseases was going on at the time. That's Brazil. Let me see what's going on in Brazil. Dengue, diarrhea, fever, HIV, AIDS, influenza, Zika virus, dengue again. I think that's Brazil, all Brazil, dengue, E. coli, dengue, diarrhea, E. coli. Bolivia, study warns that the climate crisis. Let me see what else they got going on. Is it safe to eat eggs after the avian flu outbreaks? Dengue, influenza, Chagas, dengue, leishmaniasis. I don't know how you pronounce that. I think I'm pretty close. Cases on the rise. Okay, that's Paraguay. Okay, in case you got family out there. And in Argentina, looks like a lot of stuff is going on in Argentina. Unprotected sex, sharp increase in infections of an old bacteria, dengue, avian. What's going on in Argentina? Gastroenteritis, I think as you pronounce that. Hantavirus, leptospirosis or pirosis, listeriosis, pneumonia, polio, respiratory illness, sexually transmitted infections going on in Argentina, it looks like. Dengue, you got H. pylori, HIV, AIDS. Where's that? In Chile. Influenza, meningitis, respiratory illness. It's a lot going on in South America. Let's see what's going on in Africa. Cholera over there in Burundi. In Tanzania, let me see. Preventive medicine urges Spain to increase. Cancer cases on the increase. Okay. Okay, that's Burundi. Let's see here. Tanzania. What we have in Tanzania? Chronic non-infectious disease conflict. Marburg. I'm noticing Marburg is popping up a lot more, even in one or two cases might be in the U.S. Or they were saying that it's not. I think it was Marburg that was less likely to spread. But you have some cases in Africa. You have Zimbabwe, bronchitis, malaria, and I think this is South Africa. What do you have in South Africa? Foot and mouth. Okay. Madagascar. Poisoning. Okay. So it looks like Marburg is kind of frequent. HIV AIDS in Chad. And we all know there's been AIDS cases in Africa in the past. Cameroon, they're saying HIV, AIDS, tracking viruses in nature without cages or syringes. Okay. Nigeria, what do they got going on in Nigeria? Dengue, influenza, tuberculosis, dengue fever, Sokoto State, Nigeria. All right, let's go up here. I believe this is Italy. Yep. And they're saying COVID, coronavirus, influenza, measles, meningitis, pneumonia, respiratory illnesses. There's a lot going on in this Europe countries. between then and you got some cases in the U.S. and then South Africa. Let's see what's going on in Mexico. They got a lot of red dots going on in Mexico. Chikungunya, dengue, encephalitis, tuberculosis, COVID, pneumonia, dengue and influenza, dengue again, bronchitis, influenza, COVID, dengue, influenza, meningitis, dengue, pylori or pylori, more dengue cases, meningitis. They're really concentrated with a lot of dengue cases, respiratory illnesses. And again, these things might have been going on for a while and they're just now reporting a lot of this stuff. So it could have happened several months. What's that? Guatemala, what they got going on there? COVID, diphtheria, fever, El Salvador, health experts in El Salvador alarmed by malaria. Honduras. What's going on in Honduras? Dengue. And then in Costa Rica, you got looks like dengue, respiratory illness, whooping cough. So there's a lot going on. Let's see what's going on in Puerto Rico. They're saying, let me see what was the dates in Puerto Rico. The 15th, the 14th of this month, third case of functional cure of HIV woman kept the virus. Recent rains caused a rise in respiratory viruses in the Dominican Republic, I think they're saying. Dominican Republic. Cholera, dengue, diarrhea, HIV, malaria, respiratory illnesses. Tuberculosis case, it looks like, in Jamaica. They're also saying what? Southern Haitian city mourns those killed by hurricane. Okay, we know about that. Tuberculosis killed 1.23 million last year, according to WHO and the Jamaica Observer. Let me see what's going on in Cuba. Chikungunya, I think that's how you pronounce it. Dengue and Zika virus. So there's a lot going on, y'all. Be very careful and aware. And let me look at a few orange, the low level areas in the U.S. and just see what's going on here. That's a little bit too close. Let's zoom out a little bit. All right, there we go. We got influenza going on in Arizona. I think this is Oklahoma, if I'm not mistaken. Yep. Wildlife officials warn about rabies after skunk test positive. That was on the 15th. And what are they saying here? Why is it not popping up? All right. So, yeah, wildlife officials warn about rabies after skunk test positive. That's in the OK. All righty. West Virginia sees a spike in whooping cough. I guess that's going around. This Pennsylvania, yeah, virus linked to rare paralysis on the rise, state reports. Let's take a look at that real quick. In Pennsylvania, looks like a low rating. Let's see what's going on there in Pennsylvania real quick. A virus linked to rare paralysis on the rise, state reports. Pediatrician shares warning signs. All right, the Pennsylvania Department of Health is concerned about an apparent increase in a virus linked to a rare form of paralysis in children. And a local pediatrician said that while parents shouldn't panic, knowing the warning signs is key. The department released an advisory about acute flaccid myelitis, I think that's how you pronounce it, or AFM, on November 7th, warning of an increase in detection of one of the viruses that can cause the illness. And then they're going back to September. As of September 3rd, there have been no cases of acute flaccid myelitis in the state this year, though there have been 8 confirmed cases nationwide. The condition can develop after a respiratory or gastrointestinal illness with a fever. Okay, illnesses that are common during this year. It shouldn't be common at all. All right. So for those who have children, you live in Pennsylvania, you got family, you live in Pennsylvania, let them know about this one. It's low levels it appears right now. So Pennsylvania, we did that one. All right. So yeah, let's look up these upper states here. Washington State, tuberculosis, influenza. Montana, let me see. County reports slowing flu, a few COVID and RSV deaths. Okay. So they're saying COVID-19, influenza, respiratory syncytial, I think that's how you pronounce that, virus, whooping cough. Minnesota, what they're talking about here, avian flu, botulism, other plant diseases. The latest date looks to be on the 16th. First case of deadly tree disease confirmed in Minnesota. Let's take a look at that real quick, see what they're talking about there. For those who have family in the Minnesota area, the first case of deadly tree disease. University of Minnesota researchers have confirmed the state's first case of a tree disease responsible for sudden oak death. I guess this might have something to do with whatever disease is killing the tree. But let's take a look further. With no known cure, the pathogen is always fatal in some tree species like oak, while others can just be carriers. I'm trying to see if I can find if it has any link to harming humans. And just glancing over it, I don't see anything that mentions that this can have any effect on actual people. I think it's a disease that they saying the tree gets, apparently. And let me just double check and double verify that they're not mentioning any human people can get this. This is a really worrying pathogen because it is wreaking havoc on the West Coast. It's responsible for killing some 45 to 50 million trees. The disease can be spread from tree to tree through water or over land. It causes large bleeding cankers on oak trees and interrupts the flow of water and nutrients, leading to death. Yep, still nothing about humans, though, which is good. Although trees are good to be in your neighborhood, we want to make sure it doesn't affect actual humans. So, yeah, there we go. All right. So, I think that's it, man. I think we covered quite a bit. You guys can always go back to this and, check your state. I think I read most of the states here. All right. We appreciate y'all, man, as always. We thank y'all for coming in and checking out the Pandemic News Report. All right. This has been the live real-time global health threats watch. We're going to try to do this on a weekly basis. All right. And keep y'all informed because as you see, I was reading, they've been taking their time reporting this stuff. And a lot of people can end up getting infected with a lot of different things. And they just reporting it now. Some things were months back. They even talked about one case, it was a year ago. And I guess I'm assuming, I don't know for sure, that's probably to confirm whatever they are reporting now in this month and another about a year later. So you see how that's going with all these health alerts, they're taking their time, and then while they're being slow on reporting this stuff, a lot of you could get infected with a lot of this. Okay, so keep that in mind, and definitely be aware and be safe and take your precautions. All right, we appreciate y'all, man. As always, this is the Pandemic News Report. Go to pandemicnewsreport.com. All right, pandemicnewsreport.com to continue to stay updated on any health related alerts. And with that being said, we appreciate y'all again, and we will see you again next week. God willing, we out. Peace. And now, here is your Pandemic News Report. And now, here is your Pandemic News Report.